The Ontario Patient, Family and Caregiver Declaration of Values guides what patients and families can expect when receiving healthcare services. The declaration was developed in consultation with the public and aims to support the delivery of exceptional patient care. The declaration identifies 5 key values: accountability, empathy and compassion, equity and engagement, respect and dignity, and transparency.
Being responsible for your actions, recognizing when perhaps you aren't aware of the best option or direction to take. It means being transparent and providing all the information that you possibly can in the best way during your interactions.
Understanding how a patient, family, or caregiver might be feeling. An empathetic staff is someone who makes others feel that they are not an imposition. It's not bringing any bias or judgment into the interaction and truly getting a sense of what this other person is experiencing. They understand that hospital settings can be overwhelming for people, and as such, they go out of their way to make those people feel welcome and that they will be helped in this healthcare setting.
Equity and engagement are related. When we foster engagement, we foster equity, and when we foster equity, we foster engagement. So for example, when I, as a patient advisor, when I have a voice at the table, better decisions are made. And when hospital teams are more diverse, better decisions are made.
Treating people the way you would want to be treated. Looking at them on their level at all times. Not looking down at somebody. Dignity, feeling valued. That's the main thing. And being treated equally.
It's an openness that brings about trust. I expect transparency from my healthcare providers. To be truthful, I expect them to go into detail and explain things in the terms that somebody who doesn't have a medical education can understand. When we enter that emergency department or that surgery department, no matter what department it is, we have expectations that we're going to be treated fairly and we're going to know exactly what's going on.
I've been both a recipient of healthcare and a family member and a leader in healthcare as well, and really thankful for the work that was put in by the advisors to develop them. We've been doing work with our patient and family advisors informally for many years, and formally through our patient and family advisory councils since 2014. Our iCare values are how we work together, and we would see how that happens throughout our leadership team, how we work with our patient and family advisors, our community partners. This particular declaration is driven by patients and family members and tells us exactly what they expect. Allows us to maintain as much agency in the patient as possible. They can choose and be part of that decision making, or making educated decisions about their own path and their own care.
The patient, family, and caregiver values are a complement to the existing iCare values to focus on that specific audience, patients, families, and caregivers, how staff make this audience feel.
Everyone has a role to play in upholding the Patient, Family, and Caregiver Declaration of Values and ensuring that our care is informed by the needs of the people we serve.